हेलो एवरीवन। आज का हमारा इस वीडियो का टॉपिक रहेगा सॉल्यूशंस इन सर्जरी, जो कि सर्जरी के वाइवा में बहुत ही इम्पोर्टेंट है। और मैंने इसके लिए पूरी पीडीएफ क्रिएट कर दी है, जिसमें जो भी सॉल्यूशंस है उसको यूज़ और किस तरह से वाइवा में पूछे जाते हैं और स्पेसिफिक पॉइंट क्या क्या है, इसके बारे में हम बात करेंगे। Clear solution includes spirit, Eusol, which is called Edinburgh University solution. Next is turpentine, hydrogen peroxide, and glycerine. If we further classify the clear solution into viscous and non-viscous, the glycerine is a viscous and other hygroscopic solution are non-viscous. And if we shake the color solution, then iodine gives yellowish tinge, Mercurochrome will give brownish, and Savlon will give yellowish frothing. Smell: hydrogen peroxide has ammonia-like pungent irritating smell. Turpentine also has an irritating smell, and spirit has an alcoholic smell. First is a spirit. Spirit is an alcohol-based antiseptic having 70% ethanol or 70% isopropyl alcohol. Uses of spirit include disinfection of a skin before any intramuscular or intravenous injections, then removal of iodine in preparation of a skin for any surgical operation, cleaning the stitched wound, cleaning the skin of the surrounding ulcer or open wounds. Next is a glycerine. If we mix glycerine with a magnesium sulfate, then it gives a hygroscopic action. Uses include local glycerin enema in post-operative painful constipation, used to reduce edema in carbuncle ulcer, phimosis, colostomy, work as a smoothing agent in stomatitis and ulcer, for irrigation of proximal loop in resection and anastomosis operation, and having a no foaming or a shaking, and gives sweatish smell and taste. Next is Glutaraldehyde, also called as Cidex 2%. Its color is a light olive green color when kept in front of a sunlight. Use of a glutaraldehyde is a sterilization of a Ryle's tube, catheter, endoscope, cystoscope, and sigmoidoscope, and it should be depth for around 10 hours for a complete sterilization. It's a potent bactericide, fungicide, viricide, and sporicide. Next is a turpentine. Turpentine is a volatile essential oil and obtained by distillation of a resin of a pine plant. Uses of a turpentine is mainly used in a maggots removal, which is most commonly asked. How we will use the turpentine? First, we apply locally to force the maggots to come out to the surface by cutting off their oxygen supply and making them easier to remove. Historically used as a counter irritant and topical antiseptic, but these uses are now obsolete. Next is a turpentine, its finish, and next is a Povidone iodine, also called as Betadine, used as a mouth rinse and gargle for dryness of mouth and minor irritation and infection. Used as a local antiseptic and for wound dressing, also for irrigation of bladder wound in pyothorax and in peritoneal cavity. Next is a weak iodine solution. Composition include iodine tincture iodine 5% or alcohol 65 to 48%. Use in any surgical procedure before any operation in painting of a skin. Iodine should be wiped off with a spirit after 2 minutes of painting. Alcohol increases the permeability of iodine, and iodine spirit is the best preparation for any painting procedure. In surgery, it kills around 90% of the skin bacteria in about 90 seconds. Next is Savlon. Savlon is made up of a chlorhexidine gluconate 7.5% plus citramide 16% plus alcohol 6.8%. Without dilution, its color is orange, and if we dilute with, it gives yellow color. Use include cleaning and disinfection of equipment in vicinity of the patient, cleaning and disinfection of the post-operative wound, aseptic management of a burn, in scrubbing, in cleaning and disinfection of a used catheter and appliances. Chlorhexidine alone is used as a mouthwash, and in citramide alone is used as a scolicidal agent. Next is a tincture benzoin. Tincture benzoin is an alcoholic solution of benzoin resin. Use of a tincture benzoin is applied to the skin before adhesive tapes, dressing or a stoma, applies to improve adhesion, forms a protective film over a minor cut, abrasions and cracked skin, helped in protection of a skin around wound and stoma from irritation. Main use include to protect the film over the minor cuts. Next is Mercurochrome, also called as Mercurobromin. It's a organomercuric antiseptic which is a red in color, and staining gives a false impression of a healthy granulation tissue. Use is mainly historically used for a minor cut and abrasion. Now it's absolute mainly and discontinued in many countries. Next is Eusol. Its full form is Edinburgh University Solution, which is most commonly asked in a surgical Viva or any MCQ. Having a content include 1.25 gram boric acid plus 1.25 gram bleaching powder plus 100 ml NS. Uses include to separate slough from the infected wound, ulcer, bed sores and burn wound. Acidic in pH, so therefore it is very useful in wound infected with Pseudomonas bacteria. In Eusol bath, we will dip the ulcer bearing part in a dilute Eusol solution around 30 minutes 2 to 3 times a day, which is helpful in healing of a ulcer. Next is a liquid paraffin. Liquid paraffin is a purified mineral oil used to lubricate Rayleigh tube, rubber catheter, flatus tube, and also to lubricate catgut and for maintenance of a donor area before any taking a graft, as a emollient purgatives, dressing of a circumcision, healing ulcer and burns. Next is H₂O₂, hydrogen peroxide. There is an enzyme called tissue catalase which decomposes the hydrogen peroxide into water and oxygen, and the released oxygen forms a bubble effervescence which mechanically dislodges the debris and the necrotic tissue. This is a mechanism of action which is asked in a surgery viva. Next is use include for cleaning the wounds infected or contaminated with anaerobic bacteria. It produces a frothing and brings out debris from the depth of the wound. It produces heat when it comes in contact with the tissue, thus it prevents capillary oozing. Hence it is used as a hemostatic solution after an incision and ड्रेनेज प्रोसीजर. और लास्ट में ये सब मैंने डेफिनेशंस इंक्लूड की है जिसमें कॉमन कंफ्यूजिंग टर्म्स है और जो सर्जरी के वाइवा में भी पूछे जाते हैं, तो एक बार आप इसे भी देख लेना. उसकी PDF चाहिए तो मैं डिस्क्रिप्शन बॉक्स में डाल दूँगा. और वीडियो अच्छा लगे तो लाइक कीजिएगा और चैनल को सब्सक्राइब कीजिएगा.